there's somewhere we can talk about the autoimmune stuff, and there's a lot of stuff we don't know yet. I mean, there's a lot of, I think a lot of research that needs to be done around this. But let me ask you about, because you mentioned you were big into martial arts and, an athlete. Are you able to still do that now? Are you back to exercising, or are you just been dealing with all this stuff too much to do that?
At first, the martial arts, not yet. That's mainly just because of time constraint. I 100% want to get back into jiu-jitsu so badly. But as a matter of fact, I will be watching the UFC fight tomorrow. That's my little outlet for martial arts now. But I did get back into lifting weights, which is absolutely amazing. I've had 2 knee surgeries. The transverse ligament in both of my ankles is actually kind of hanging on by a thread. I've thrown punches my whole life. I broke my hands. I broke my hands and torn ligaments in my hands a couple times. Tore the joint capsule on my right elbow into 5 pieces. The alar ligament on the left side, attaching my atlas vertebrae to my skull, is pretty much gone from judo. So exercising for a long time was just incredibly painful for me, and I can do squats again. I did 10 reps Monday. I did 10 reps at almost my body weight. First time I've had that much weight on my back for over a decade. I mean, I graduated high school in 2005. Before that, and it's not painful. I can squat calf to hamstring. I haven't been able to squat down to tie my shoes calf to hamstring for 20 years. I'm 36 years old. I haven't been able to do that since I was 16. That's incredible. That's amazing. I did double overhand grip with no straps, deadlift, 160 pounds, 10 reps, not bump stopping, dead stop, butt up, re-squat, pick up the weight. And I did it with no rest. And I haven't deadlifted in 15 years. I haven't been able to, like my knees would not allow it. And I mean, I know that deadlift is mostly a posterior chain power, movement, but you still got to bend your knees. It's the leg press until you get above your kneecaps, and I just couldn't do it. And not only have I been able to do that, but I can run. I did a mile in a little less than 7:30 the other day, just to see if I could do it. I haven't run a mile since I was in high school. I haven't run a mile since I did the presidential physical fitness test my freshman year in high school, and I ran the same mile. I ran the same mile time just a couple of days ago, and I've been able to do things that I never thought I'd be able to do again. I did the Barbarian, challenge from Liver King the other day. Didn't do it as heavy as he did. Obviously, I'm about a third that man's size. 145 pounds. I don't think I could pull off 70-pound kettlebells in each hand plus 70 pounds in a backpack for a mile. I don't know if I could do that or not, but I had 120 pounds of gear on me. And then I did a mile like that, and I was able to do it, within about 35 minutes. I pulled it off in 35 minutes. Just incredible. The amount of pain that I used to be in, that I just don't have anymore. It's truly impressive. I used to have periodontal disease, And by used to, I mean I used to. I no longer have periodontal disease or gingivitis. That's gone. And I didn't do anything differently. You know, I didn't change my toothpaste or floss more or, you know, anything like that. My gums are now a beautiful light shade of pink. They're no longer inflamed and red and bleed every time you touch them. Literally, the overall health is just astronomically better. It's
clearly for you, you've had this tremendous gains. I mean, the overall quality of life, just not being in pain, not getting all the allergy, sinus infections, obviously the Graves' disease, the diabetes, all of that is, I mean, undeniable how much better your quality of life is from what you're saying. And there still will be people who will say, well, you know, hey, your cholesterol may go up and therefore you're putting yourself at risk for heart disease. What do you say to that? I mean, even, you know, we're not sure if it's true or not. I mean, as far as, you know, overall risk, maybe your LDL cholesterol and that risk factor went up, but overall risk may or may not be up. But let's assume it is. Let's just assume you've increased your risk for cardiovascular disease by, I don't know, 10, 20%, just to throw a number out there. Is it more important for you to have a quality of life that you have now, or are you more worried about that?
I won't deny that there aren't really definitive studies out there that prove that. But the only reason that I think plaque gets put in your arteries is for the sole intensive purpose to keep your artery from bursting, because there's been damage done to it by glucose levels being entirely too high. But to that, I would say this: if my heart is going to stop beating because my LDL or HDL or triglycerides are too high, the trade-off to that is I get to run a mile in less than 7 minutes and 30 seconds for the first time in 20 years. I get to do deadlifts again and practice jujitsu and throw an arm bar, a go-go plata that I can run, teach my nieces how to play volleyball and basketball and softball, take my daughter to Disney World and spend 13 hours at Disney World carrying her on my shoulders when she's too tired to go to the next ride, which happened, by the way, in June. Sign me up. I'll take the heart attack. Bring it on.
Yeah. And I don't know.
They can put a stent and fix that.
Right.
You know, I mean, if that's the case, which I don't believe that for half a second, because, you know, I had a stress test. I passed it. I know I can take my heart rate to 190 plus beats a minute at the age of 36 and not feel like I'm going to die. And I can do it day after day after day. And if you can do that, I've had an ultrasound of my heart and the arteries of my heart, and there's nothing in them. I plan on doing it again next year to see if there's anything in them. And per watching your you know, podcasts and your clips on YouTube, I plan on having is it a CAC, correct?